Dr. Taveras, are there differences in the stage of AML at diagnosis between underrepresented compared to other racial and ethnic groups? And if so, what factors contribute to these disparities?
So when we think of cancer stages, we usually refer to stage 1 through stage 4, stage 1 being the cancer is localized to where it started, for example, breast, lung cancer, just in that breast, just in that lung, small. And as things spread farther and farther from where they started, then you have stage 2, stage 3, stage 4. So for AML, it is a blood cancer. So technically, it's all through our body, since our blood goes all through our body. There may be patients that present with no complications from their AML, and we're assuming that they presented promptly from when their diagnosis, from when their disease started, and other patients that may present with some complications from their acute myeloid leukemia already. So there, the assumption is that the acute myeloid leukemia has been ongoing for some time, but it is really hard to really determine when the acute myeloid leukemia started, unless the patients had been undergoing very frequent blood works previously. We do know that patients who are Black tend to present with AML at a younger age, and we're not sure what factors contribute to that. We also know that they may be at higher risk of complications from treatment, as are Hispanic patients. We also know that their diseases may be more resistant to treatment and associated to mutations that are more aggressive. So those are the factors that contribute. A lot goes into the treatment responses for our patients, and we want to achieve a remission and maintain a remission. And these patients require frequent healthcare visits, and they may have barriers to that depending on their work, childcare, transportation. There may be many barriers for these underrepresented patients that they themselves don't feel as though the healthcare team needs to know about. But it is very important for us to know about these barriers so that we can do our best to address them, and the patient can receive the care that will ultimately give them the best chances of survival and response to treatment.